This has been an exciting year for Northern Territory PHN, and I would like to share some of our highlights with you. One of our greatest achievements this year has been the co-design of the Strengthening Our Spirits model as part of the National Suicide Prevention Trial for Aboriginal and Torres Strait Island people who live in the Darwin area. This model, incorporating the 4 elements of fire, land, air and water, was coordinated by NTPHN and led by members of the Aboriginal and Torres Strait Island community. The Strengthening Our Spirits model sets out a community-designed, systems-based approach to suicide prevention. Activities are now being commissioned that meet the elements of the model. The Rural Workforce Agency NT is a really important part of NTPHN. Our team helped to recruit primary healthcare professionals to the Territory, and we support them through grants and professional development opportunities. Our Rural Workforce Agency has had a very successful year with 22 GPs, 29 nurses and 56 allied health professionals recruited to jobs across the Territory. We also awarded over $1 million in grants and scholarships and provided 113 continuing professional development events. Our flagship event, the Compass Conference, was held in November 2018 and was a resounding success. More than 250 delegates gathered in Darwin over the 2 days to learn, network and share ideas, and together we celebrated the winners of the Health Professional of the Year Awards. We also introduced a new award category called Primary Healthcare Support Person of the Year to recognise valuable support staff like receptionists and drivers who are sometimes overlooked. Northern Territory PHN has also been working hard this year in the digital health space. NT Health Pathways is a locally developed clinical pathway website to help clinical teams, especially GPs, navigate complex variation in referral pathways and management of conditions for their patients. In the last year, more than 200 pathways were developed, bringing the total number of localised pathways to 250. This is a wonderful milestone in such a short time, and we look forward to making NT Health Pathways even more comprehensive in the year ahead. As we mature as a commissioning organisation, it is important to have effective monitoring and evaluation processes in place. In 2018-19, we introduced our monitoring and evaluation framework, successfully embedding the framework into several flagship projects. This development represents a major advancement in how we do business, consistently ensuring that we focus on commissioning towards outcomes. Another big step forward in our commissioning practices this year has been in the commissioning of allied health outreach services, such as podiatry for people living with chronic disease in remote communities. After 6 months of consultation and co-design with local health services within 5 regions, we launched our new service delivery models in January 2019. Using locally based professionals to deliver care has major benefits for communities, including more frequent access to services and a shared understanding of the local context. Importantly, the new delivery models support community control wherever possible, so that local communities can be in charge of their own healthcare provision. We have made great strides on our reconciliation journey at Northern Territory PHN this year. Our Innovate Reconciliation Action Plan, or RAP, is our roadmap for putting reconciliation at the heart of our organisation. Initiatives we've put in place include an online cultural induction for all new employees and strategies to actively recruit Aboriginal and Torres Strait Islander people to join our governing councils and our staff. This has been a year of growth for us at the Northern Territory PHN, and I attribute this success to our wonderful team of passionate and committed people. But we can't do it alone. Our partner organisations, healthcare providers, health professionals and communities have all worked tirelessly alongside us to improve the health and wellbeing outcomes for all Territorians. We are so grateful for your contribution and look forward to continuing to work together into the future.